Today we are going to see about measles. Okay, it's caused by RNA virus and it is a cutaneous infection. The measles objectives are pathogenesis, clinical manifestation, complications, prevention, and measles vaccine. The measles vaccine is more important, and we start from introduction. It's acute and highly contagious, and the clinical features are fever and respiratory tract symptoms and followed by macropapular rashes. Coming to the pathogenesis, the transmission is via respiratory route because it affects the mainly respiratory tract. The transmission via droplets inhalation and small particles aerosols that remain suspended in school, hospital, enclosed public places. And the target site is most predominantly in epithelial surface of the body, including skin, respiratory tract, and conjunctiva. And coming to the how the measles virus spread. The virus first multiplies locally in the respiratory tract and it spreads to regional lymph nodes and it enters into bloodstream through infected monocyte and it multiplies in reticuloendothelial system and it spills over to blood and disseminates to various sites. First, it enters into the body and it multiplies in respiratory tract and spread to lymph nodes and enters into the blood and infected the monocyte and then it multiplies in the reticuloendothelial system and it disseminates to various sites. Okay, and the target site predominantly be seen in epithelial surface of the body, including skin, respiratory tract, and conjunctiva. And coming to the clinical manifestation, the first incubation period is 10 days and it varies from adult. It may vary from 3 weeks. It have three stages. First, prodromal and eruptive and post measles. In prodromal stage, for last 4 days from 10th to 15th day of infection. After the incubation period, the starts from 11th day to 14th day. Starts by fever and coplic spot. After 2 days of the fever, it means 12th day of the fever. The coplic spot is nothing but white to bluish spot surrounded by an erythema. It appears first on buccal mucosa near second lower molar tooth. Okay, and they rapidly spread to involve the entire buccal mucosa and then fade with onset of rash. The other symptoms are cough, chorea, nasal discharge, redness of the eye, and diarrhea, vomiting. In the eruptive stage, the maculopapular red rashes. That means after 4 days of the fever from the 14th day. Okay, the rashes appears behind the ear, then face, arm, trunk, and legs. And the rashes absent in HIV infected people. Okay, you have to keep it in your mind. Rashes absent in HIV infected people. In the eruptive stage, maculopapular rashes appear on 14th day and starts from behind the ear and then face, arm, trunk, and legs. And coming first 10th day, fever appears. 12th day, colic spot appears, and the rashes on 15th day. Okay, incubation period is 10 days. In the post-measles stage, it is characterized by weight loss, weakness, and maybe failure to recover or gradual deterioration into chronic illness. The complication mostly occurs in under 5 children, okay? Adult more than 20 and pregnant women, immunocompromised host. And coming to the measles leads to bacterial infection, measles virus itself and CNS complication. It's also associated with the otitis media, bronchopneumonia, giant cell pneumonitis, acute laryngotrachea bronchitis. Diarrhea leads to malnutrition, vitamin A deficiency in the under 5 children, and SSP, that's means subacute sclerosing panencephalitis and encephalitis. How to prevent? It's a airborne transmission, so airborne precautions and use PPE and N95 respirator. And coming to the measles vaccine, it's a live attenuated vaccine. Three strains: Swat strain, Edmonston, Zagreb, and Martine. Vaccine prepared from checked embryo cell line. Okay, it's live attenuated vaccine. Just remember it. Measles vaccine is a live attenuated vaccine. The reconstitution vaccine is lyophilized in form. It's diluted in distilled water before use. Within 4 hours, we have to use this diluted form, and it is stored at minus 20 degrees Celsius. 0.5 ml subcutaneous in the root, and 9 to 12 months and 16 to 24 months along with vitamin A. Okay, 9 to 12 months and 16 to 24 months along with vitamin A. 0.5 ml subcutaneous in the root. Okay, it's combined with MR, MMR, MMR, and B. And the contraindication this vaccine are allergy reaction people and transplant people and chemotherapy, HIV people and pregnancy, active tuberculosis. We should not give in this people because it's contraindication. Thank you.